everybody. Welcome to the Technology Evangelist podcast. I'm Dr. John Fluke, Technology Evangelist, and we are sponsored by Medidenta Digital. And today, this is going to be a great conversation because it's a conversation about product development and how a dentist that I know has brought not one, but at least 4 products to market, but about his journey in that and how it goes. So we're going to talk about that whole recipe and show you some of the things he's working on. He's a dentist in the I think in the UK or Ireland. I'm going to let him do his own intro. Ladies and gentlemen, Dr. Paul Moore. Thank you for being with me, Paul.
Thanks for having me, John.
Yeah.
Well, we've known each other for a good few years, and
We have.
it's great to see you doing your new podcasts.
Well, for people that have been watching a few episodes, we just dropped one recently with Shannon P. Sprinker. And it's funny how everything in the world, we're all, the 6 degrees of separation. Shannon is actually the person that introduced me to Paul. She's like, this guy's got some great ideas. You got to talk to him. And so we met, I don't even know, I think it was before COVID. That we met and corresponded, and what a great world it is. You can, meet people and become friends with people that are, all over the planet. But Paul, what I'd like to do, everybody loves the backstory. So take the Wayback Machine, wind the clock back as far as you want to go, and tell us, what got you interested in dentistry and basically how you got from your childhood to where you are now.
Well, it goes a long way back. That's the big problem, isn't it? So I was born in Walsall, a small town near Birmingham in the UK. My parents were both doctors, and I have 6 brothers and a sister, all who were in medicine, ranging from neurologists to physiology. It was a big medical family. Interestingly, my father passed recently, and we worked out that my mother and father and the brothers and sisters between them had done over 500 consecutive years of service to the health profession.
Wow.
That's including 1 vet, actually. So
I think it still counts, though.
Yeah, actually, did you know that vets are qualified to treat people? Doctors and dentists are not qualified to treat animals.
I didn't know it worked that way. I know a lot of the equipment is the same. We took one of my labs in one time for a vet visit, and they did x-rays and emailed them to me, and they were DEXAs, which I thought was pretty funny.
Yeah,
but anyway, I didn't know that about vets could treat people, but I knew people can't treat animals.
I think sometimes some vets might be better than some of the doctors and dentists I know.
I would venture to say that's probably true.
Yeah, anyway, I didn't want to be a doctor because of the hours that they work. Oh, how foolish was I? And I chose to do dentistry. And I qualified in Sheffield in 1981 and worked for 20 years in the UK, then came to Ireland, where I live in Galway. I have a clatter of children, 6 of my own from my first marriage. I met Hazel, who has 2, and now we have 1. So altogether we have 9 children.
Wow.
Only one of them has chosen to do dentistry. I managed to put the rest of them off, but he's looking to join a profession, so that'll be interesting. And Ireland's a wonderful place to work. They have great collegiate sort of environment where you can talk with your colleagues and share without any concerns. It's a lovely environment to work in. So in Ireland, I took over a practice in Galway, and it was an interesting challenge. We set up a new premises. We won the best practice of Ireland. We won the best technology in Ireland. We
Nice.
best marketing in Ireland. So it was quite a journey going through it. It was quite entertaining, challenging, what with recessions and COVID and all the other problems
Right.
that we had to deal with. But I was always pleased. We were the first practice to introduce CBCTs to Europe. So
Really?
yeah, we
Wow.
had the
That's
first.
now that's quite an honor. Wow.
Yeah, yeah, I went over just as I was moving practice. I saw this new machine in Minnesota and went over to see it. And I was so impressed. I said, "Can you send me one?" And he said, "Well, we haven't sent anyone anywhere these things yet." So we had the first CBCT, and at first it was sort of like almost ridiculed, but very
Right.
quickly became established as wow, that's the way to do it. The communication that you have with the patients is just amazing when you can tell them what you can see.
Yes.
So that was setting the tone for the practice. And I learned an awful lot about dentistry, which most general practitioners back there were sort of like just getting into.
Yeah.
Um, we also had the first digital CEREC machine in
Okay.
Ireland, and I've been the
Wow.
trainer since. So it's only a very small profession in Ireland. With I think there's 1,700 dentists. It's not a lot,
Okay. Yeah.
um, but the CEREC journey was fantastic. It made a huge difference to the practice, and it's obviously progressed massively now. And digital
Yeah.
dentistry is just like it's gone forward in leaps and bounds. I'm still always a little bit surprised by the lack of the profession to adapt more than the digital camera. They don't
Yes,
do
I agree.
lots of dentists don't do the design, and I feel they're missing out in one of the big opportunities where if you're designing your own crowns, you're also by default reviewing your own preps.
Yes.
If you ask most digital dentists what is a parameter, they haven't got a clue.
Right.
So that knowledge really enhanced your understanding of what and why you were doing it. And interestingly, I was giving a talk at the Royal College of Surgeons in Dublin last year, and during the talk, I'd worked out that for over the 20-year period I've been doing CEREC, if you had made 2 restorations per day, saving the lab bill to
Right.
the practice, it actually accumulated to over €2.5 million in that 20
Wow.
years. That's a lot
Wow.
more than I sold my practice for.
Yeah.
Um,
Yeah.
it's a sort of, I think it's going to be an old skill that people are missing.
And
If you
when
design,
you look at the screen and you see your preps blown up 30 times, you can't help but get better. I
you
mean, I
learn.
know I did when I first started scanning and I looked and I was like, that's what I'm sending them. Um, it
Yeah.
just made me better.
It gives you sympathy for the laboratories. Thank you, chaps. You do a great job.
Yeah, absolutely.
So, anyway, in that journey, we've sort of coming towards the end of my professional career, I suppose, clinically, but I'm still working part-time with a prosthodontic practice, really enjoying the challenges of complex dentistry.
Sure.
Uh, enjoy the little things as well as the complex things.
Right.
I always think the skill that you learn over that time period isn't just the clinical skills, it's the professional skills of communication, how to talk to your patients. Actually, I was approached last year by a young lad who was no longer a young lad, actually. I was at one of the trade shows with our range of products, which we'll talk about later.
Right.
And he came up to me when he was about 23 and he said, "What would be the best advice you can give me to be successful in general practice? What can I say to my patients? And I told him whatever it was, and he came up to me last year. This was like 20 years later, and said, "I came to see you 20 years ago, and you gave me a bit of advice." I said, "Did I?" He said, "Yeah, yeah." I said, "What did I say?" "I asked you this question, and you said to me, when you finish your treatment, walk the patient out to reception, make sure they get their bill, and you always say to them, if ever you have any problems, you let me know. And if you have no problems, let everyone else know."
Beautiful.
So
Beautiful.
I'd forgotten that one, but it's interesting how many of those little anecdotes there are within a dentist's career that can help other people. And it's that communication skill that
I
has
have
helped
this
my career.
I have this theory that we can all be profound. We can't all be a philosopher and write books, but we can all be profound. And I think that some of the most profound things that I've gotten in my career, and I think this story kind of highlights that, is that you don't even remember doing something that created a tremendous impact on another person, but the other person never forgets that. And it's the old analogy, Paul, of, you drop the rock in the water and the ripples go out, and you just have no idea where those ripples go. And it's
Yeah.
so true. It's so true. You give somebody just a little piece of advice on something, you don't even think about it, and later they come to you and say, that changed my life, or that changed my practice, or that changed how it's an
Mm.
incredibly amazing thing.
Yeah. It adds to the fun of it. And fortunately, with these advancing years, I have the privilege of forgetting lots of these things that I said. And
Or if you don't want to talk about it, you can simply say, I don't remember, and people will believe you.
yeah, 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 yeah. So it's good. Um, so somewhere during that journey, I always used to have to, what was the word? Innovate to try and
Right.
improve what you're doing,
Mm-hmm.
to make it more efficient or work better. Um, and I think it was about 2010. I was trying to organize my inventory for CEREC blocks.
Mm-hmm.
And it was come in these little boxes, but still come in the little boxes. And
Yeah.
we'd have to try and keep all the different shades. There's about 13 shades, the
Yeah. The
three,
inventory management on that is difficult.
yeah, there's three translucencies. There's I would use three or four materials. It'd be Emacs. You've got Vita products. You've got
Mm-hmm.
Anamics, and my nurses would always put them back in the wrong boxes, and I didn't know what stock I had.
Right.
So we made a silicon board, um, and there, here we have one there. And it just stock controlled all of our products so we could see what was
Yeah.
what. It was sort of like our first venture into efficiency, trying to
Mm-hmm.
make products that were better. And since then, we've developed on the same concept. I tried to organize burr holders so that they were more efficient and you could see what you got, and you didn't have to take the burrs out and pouch them and sterilize them in
Yeah.
little tea cozies. And
Right.
we
Right.
so that was using the same material. Um, and that's a lovely story. We came up with this idea of storing the burrs all in a block, but we couldn't think of what
Yes.
material to use. My wife was Hazel was cooking in the kitchen, making cupcakes with silicon cups to hold,
Right.
and we just ha ha, eureka! And we used that to make these uh, burr blocks, which can be autoclaved because silicon you can take it up to 300
Yeah.
degrees. no problem. It's a wonderful material for cross-infection control, etc.
Yeah. Do you have
Um,
the Endo Butler sitting there by chance? Because I love that.
it's the one I haven't got. I should have
Oh, that's okay.
got one.
That's
Um,
okay.
but that's a little product that sits on top of the Burr Butler. Um, because you can't put the endo files sticking out of the silicon. You have to
Correct.
stick them into the silicon. So we created a little chamber underneath with measuring columns. And the idea was that normally the dentist doing the endo has to measure his own files and set their own stops. And um, this was so that the assistant could measure the files and you could have a set of 21, 25, or 31 millimeter endo files that you know what size you're going to use for
Right.
the root canal you're going to do. So you just pick up the 25 millimeter set, do your end measurements, and then the assistant can set all those files to that end measurement.
And
Um,
one of the things that I want to mention about the whole Butler line of products that you have that hold things is when I first got it, I thought, okay, this is nice. I liked it. But then one day we dropped one and none of the burrs came out because the holes are a little bit smaller than the shank. So you can actually turn that upside down because most people use some type of burr block, but they're all aluminum, but you can't do that with them.
that's
And
right.
the fact that nothing gets spilled with those types of blocks, that's genius to me. I mean, it really is. It holds everything. You can autoclave it. It holds up under temperature so it doesn't get discolored. It doesn't, all the anodized blocks out there, you get them and they're all shiny and pretty. And 2 years later, all dull and they're scratched. If you have to have them, if they're painted, the paint's chipping off. But that silicone looks just like the day it came out of the box. It just doesn't age.
Unfortunately, they don't. We've had people
Yes.
come back and 10 years and they're still working fine. Um, the holes are actually parabolic in shape. So
Didn't
as you
know that.
stick your as you stick your burr in, the end diameter of the burr engages the diameter of the parabolic curve or cone, and then a tiny little grip push is all you need to grip it. It doesn't take a lot of force to push them in, and it doesn't
No, and it
take a lot.
doesn't take a lot of force to get them out either.
You can literally just pull them out,
Yeah.
touch them in, and they won't fall out.
Yeah. I mean,
Uh,
seriously, that is a genius thing. That's one of those things I love products like this because you look at it and you just say, it's so simple. You know, why didn't I think of that? Because
we
it makes your life easier. You want to use them. It's a genius concept.
in
And I
the
mean that, I really do.
Thank you.
Yeah.
In the original design, this will be a tribute to my father. In the original design, the block of silicon would
Uh-huh.
expand in heat and distort the lid. The
Ah,
lid, the lid is made of a clear autoclavable. It's a high quality polymer, um, and the lid grips the side of the burr block. But we were trying to work out how could we stop it from distorting the lid as the silicon expanded.
right.
So my father suggested this groove, or if you like, a lip round the
Yeah.
base. And as the silicon expands, the lip takes the expansion.
Yeah.
Uh,
It's
and
basically an expansion joint.
yeah,
Wow.
and these little buttons on the top allow you to just simply remove or replace. But because it's clear, it's the only block with a autoclavable cover that actually covers the burrs, which protects against dust control. And in COVID, obviously, that was a thing which we was highlighted.
Sure. Yeah.
But you can see through it. You can see what the contents are with at a glance. And of course, we color code them. We've got 6 colors, which allows you to organize your practice whichever way it is that suits.
Right. And most
So,
people do, my crown and bridge setup is red. My operative setup is blue.
yeah,
And it's just easy. Even the tray that we use are color coded, and you just know red goes with red, that sort of thing. So yeah, I mean that just I think it would fit right into everybody's systems.
and we got some lovely vibrant colors. So it's sort of like the pink one goes down well with a lot of ladies.
I can
Um,
understand that.
it's very colorful. So, yeah, and everyone has their own priority for colors, their own preference. So,
Right.
um,
And it's good to
well,
have choice.
yeah, yeah, and it's great where you've got a multiple practice because you can arrange it by dentist, by clinic, or by procedure. But where you've got 2 dentists in a practice that buy their own stock, it means John's got blue and Paul's got orange, and John
Right.
shall not have Paul's burrs that Paul has bought. So
Well,
it
and
sort of keeps,
that's the other thing, if you're putting them, if you're sterilizing burrs, a single burr or 2 burrs in a little tiny autoclave pouch, when they come out of the autoclave, whose are they? What kit do they go in? And it's just so much easier.
yeah, you just leave the burrs in the burr, but process them
Yes.
through. They go all the way through the autoclave procedure, and you can pouch them. And even if you're using single-use disposable burrs, which regulatory wise in America you're supposed to, you
Mm.
still have to set them up on something. So you can set
Yes.
up the dispose of the burrs that you've used, just replace the ones that you're disposing, and you've got your burr set all set up. The nurses absolutely love it. It saves them so much work. And so it's
Yes.
a time thing, um, which is part of the whole environmental setup. You're using less pouches. You can see what's in it. And those paper pouches, you can't see what's in which burrs are where. It drives me
Right.
nuts. So that was our go-to for a long time, and we started off at the IDS show in Cologne. It's a huge show. If you haven't been to it, absolutely recommend it. It's
It's the
just
world's
eye-opening.
largest dental trade show. I don't even know how many exhibit halls there are. It's massive.
Have the average conference has about 10,000 visitors. The
Mhm.
IDS has 180,000 visitors. It's brilliant. It's great.
Yeah, it is. You honestly, you can't see everything. I mean, it's that big. You just can't see it all unless you run.
No, you just have to go and see ours. That's the only one that matters then.
That's right.
Yeah.
That's right.
Um, so we also, in my CEREC digital Crown Bridge restorative practice, we also developed um, this chap. I don't know whether you saw this, John. This
I
is
did.
what would you do with,
I would say
and when
that's how
you,
you organize crowns or veneers for cementation.
exactly. So
Beautiful.
when you take them to when you take them to the patient, it allows you to organize upper left, upper right. It just keeps things in order because you absolutely hate that moment where you're trying to cement an upper left uh, veneer on a lateral, and you've picked up the upper right one and you've
Yep.
etched the left one, and you're going So it's such a simple idea. It just replaces a piece of paper where you
Yeah.
touch it, it's flying. Um,
Well, and
so
if you pick up the wrong one, I've never picked up the wrong one when I'm cementing. I've picked up the wrong one before I was using this. I picked up the wrong one a lot on try-in. But when you put that luting cement inside the veneer, inside the 3/4 crown, that the cements work really well. But until they're bonded, that stuff is slick. And if you load up the wrong one, and now now you got to put it back. Now it's got looting material all over it. It's starting to run, and then you try and pick it up. And I will tell patients, I say it's like picking up a marble soaked in baby oil. It's just the coefficient of friction is so bad that they're almost impossible to seat. So with that I love that because you know exactly what you're picking up before you do anything.
Yeah, interestingly, we looked at making the lid a photo inhibitor lid.
Mm-hmm.
In practice, by the time if you place the cement in the veneers and then go to place them, by the time you've placed the upper left and
Mm-hmm.
you get to the upper right, you're in trouble because the cement has started to set, even if you had it on
Yes.
the lid. So the lid isn't actually a photo inhibitor lid. It's just there as a cover,
Okay.
um, everything clean. Um, it actually comes hugely into its own if you're doing full arch implant work
Yes.
because you can take off the healing caps and put them in the right collet, which are numbered. Uh, do your try-in, and you've got all your components and screws and drivers ready on the same laminate butler base. And then when you take everything off, you know where all those healing caps, which may be of different lengths, have to go to
Yes.
fit the denture which you're using as temporary. So that, as a prosthodontist type dentist, that's one of
Mm-hmm.
the things for most. Um, so that was an interesting one. Um, but I was going to show you also our um, latest and greatest would be the best way I put it.
Yeah,
Um,
please do.
talk about the design, how you start from a question and come up with a
Right.
concept, take it to market. Basically, we wanted to look at seeing if we could develop a new lip retractor. Um, initially, this was to be used as a photo contraster for taking just for photography, and
Mm-hmm.
we've previously used the excellent Ivoclar um, Optrigate, which has been
Yes.
a long time. It's very good at retracting, but visually
Mm-hmm.
looks a little bit, I don't know, can I say gynecological? Um, um, so we came up with an idea of using the same silicon material, which we have known and worked with for many years. And we came up with a retractor that was flexible. Can I show you? This
Yeah.
is flexible, it's really soft. And we were trying to develop this so it would be a functional lip retractor as well. So, what I was going to suggest we talked about today was how do you take an idea through from concept to marketing? There's a lot to
Absolutely.
um, the first and probably most important thing to think of is you've got an idea. Are you prepared to follow it through? Because there's a lot goes into developing an idea to a product and taking it to market.
Yes,
Uh,
there is.
you've got to, first of all, find out think of what features and benefits you're trying to better,
Right.
which means look at what's out there and try and see what needs to be improved or could be improved. So
Sure.
the first thing for me was the comfort. Um, I was trying to make something that didn't pinch on the freeney when you were wearing it, particularly for long visits,
Yeah.
where you've got the aesthetics, wanting it to look better. You've got the efficiency that boils down to uh, not only the cost, but the environmental impact. And I wanted to get away from the disposable
Right.
environmental impact of throwaway dentistry. and come up with
And
something that
the
was.
other great advantage about that is, I think, is the cost. I mean, disposables have an environmental impact. They've also got a financial impact because every time you use one, it's a fixed
Mm.
cost, or it's a cost that then, you have to, somehow recoup that cost. So having something in the autoclave has, I mean, it's got a great impact on that as well.
Yeah, because you autoclave the rest of the instruments. It's not actually an autoclave process for each time you use it. You just put it in with the tray when you're
Yes.
autoclaving other products. But I was amazed. Some practices use maybe 5 a day, some use 10 a day, some
Mhm.
orthodontic practices or hygienist practices use 50 or 70 a day. Uh, in America, I'm not sure what the price is, but you're probably somewhere between 150 and two for disposables. You do that
Yes,
10 times a day, and you do that 200 times a year. That's a lot of cost.
it
Um,
is. It
you're
is.
paying like three, four, $5,000 a year on disposables, and you're throwing away an awful lot of them. Um, so for the cost of a single vision butler,
Hmm.
um, you're paying the entry fee, but it works out about 10 cents per use over 1,000 autoclaves. We've tested this to 1,000 autoclaves. It'll probably do more, but that's what we're regulatory have tested it to.
Okay.
So it's
Good to know.
huge financial savings. Um, and I think there's still a place for the disposable autoclave, disposable retractors,
Right.
but I there's no retractor does everything for everyone. It's
Right.
choosing the right one for the right. What are you doing with it?
Hmm.
Um, so we were then trying to make it uh, as comfortable as we can. So and there's a
Yeah.
great. We developed, as I said earlier, the black one as a photo contraster,
Yeah.
and this is what we call the medium size.
Okay.
We've got a small size, and we got a large size. So these things were really easy to place. Uh, we You simply fold the four corners, and there you go. That's a
Presto.
medium size.
Nice.
Ah. So this actually is the wrong size for me, and we size it from top to bottom
Okay.
according to how wide you open your mouth. Ah, so the big size is my size,
Okay.
and
Super easy to place.
lovely
Yeah.
and quite attentive, you know.
Uh-huh.
Uh, ah. So we made it in a black satin finish for photography, for flash photography. Um,
Beautiful.
and some of my colleagues said, would you not think of a different color as well for operative dentistry? So we went to the IDS and first showed our pink version, um, and it was an eye catcher. I mean, people were just looking at the pictures on the
Yeah.
stand behind. Huh? So we have a lovely pink, and again, it's this wonderful flex. Uh, There you go.
Wow.
Uh,
Oh yeah.
we actually designed the top edge on the internals. It's shallow on this side and it's a bit deeper on that side because depending upon your free knee anatomy,
Hmm. Right.
sometimes it works better the other way. So there's not an up or a down, but up and
Okay.
down are different. Up and down are different, and it works differently for different people.
Sure.
Uh, Super for front teeth, uh,
Hmm.
brilliant. Back teeth, it's a little bit more difficult to get to the very back teeth working on it. But for photography and hygienist work, makes a huge difference. The operator can almost work single-handed. But you can wear them because they're so soft. They're just like all the edges are fine and tapered so it doesn't pinch or break in.
You know,
But when
that's
you're,
always been one of the things about, there are some that have like a, I think there maybe it's silicone or some type of a softer material, but they've got like a plastic frame, a flexible plastic frame in them.
yeah,
And I've been through the use of those. After a while, the frame starts to really dig in and it hurts. And I had one of them used on me, and we had to stop and get a break because I was like, I can't take it. I wasn't numb in that area. And just, the constant pressure of a hard plastic made it
yeah.
uncomfortable.
And when the patient's numb, they can't give you that feedback either.
Exactly.
It can cause ulceration
Hmm.
and it can be distressing. So that was what we were looking for when we were analyzing what we wanted out of the product.
Right.
We, uh, I'm just referring, I've written a few bits down there just to jog my memory.
That's okay.
Uh, that
So after you
so
came up with the idea and you kind of figured out, here's the
mm,
problem, here's how we'll fix it. Take me to the next step.
well, the next problem is we had to actually draw what we wanted. That was
Oh,
really difficult because there are so many
oh yeah.
curves. I don't have a design team and a big
Hmm.
corporation behind us.
Yes.
So we set to designing and developing, still couldn't get to drawings that a manufacturer could use. So believe it or not, we made it out of Fimo and molded it to where we wanted. And then we used this is why I referred to my CBCT. We scanned it
Right.
and
Oh.
digitalized the Fimo into a scan and then modified the digital image on the scan to start forming our prototypes. Now, the most important thing I can give as advice to anyone if you're going to design a product is use a professional designer. They're brilliant. They actually know what they're doing. You're a dentist. You're not a design.
Right.
You design teeth. You don't design products. And with their help, working alongside professional designers and a UK company who specialised in silicon that had made all our other products, we were able to slowly refine the drawings until such stage that we went to prototypes. And they make the prototypes with they print them all, they print the tooling and inject the silicon into the prototypes. And you have to try it, refine it, say, I like this, I
Hmm.
don't like that. And they do another one. And we do that several times to get to where we thought, okay, now we're on the right track.
Sure.
Um, so it's also important with your designer, you have NDA clauses
Hmm.
to protect your ideas. And at this
Right.
stage, once you've designed your ideas, you need to be talking to your IP, your patent officer.
Uh-huh.
Don't do, don't do this without a patent.
Yeah.
Um, they have their own language to describe the various features of your ambitions, and it takes a lot of effort, a lot of cost, and you
Hmm.
have basically 3 years to once you've put your patent through, you have the preliminary patent time before the patents are awarded for the individual countries. Um, at that stage, you want to be in the market because you're trying to prove concept,
Right.
um, so you can take it to the market, uh, and then that's a whole new experience for a dentist taking a product to market. There's so much to it. You've got to do all the FDA, or in our case, the CE regulations to complete all the medical device registration,
Right.
to do testing on the prototype, testing on the final product, um, which will involve 1,000 autoclave cycles, and all the other data that you've got to put into
Right.
a medical device registration. Um, it's a skill that a dentist doesn't have, but I had to learn. I had to delegate a lot to professionals, but you need that to be able to start selling the product. Um,
Well, and I think that's important, Paul, because I think a lot of times dentists, we do kind of we're the kings of our own little kingdoms, and we sort
mm,
of think that I can do this, or I have to be involved in it. And if you've got the right NDA and you've got the right people, you can oversee and still steer the ship, but you're not down in the engine room shoveling the coal at the same time. And when you're running a practice and trying to create a product, I mean, those are time consuming exercises. And I think it's important for people to realize it really does move you to have people that know what they're doing, that have done these kind of things before to kind of help you along the way.
yeah, you need to delegate facets of your program to other people. Um,
Mm-hmm.
I think one of the things I wasn't aware of, and I've been lucky with, is you also need to have support of your family, your
I
partner,
would agree. Absolutely.
because this takes a lot of time, it takes a lot of effort, a lot of willpower, and commitment.
Yes.
Um, you need to know at the end of it, there's going to be something that you can benefit from, and
Right.
that has to outweigh the hardships and the cost and the commitment of everything you're putting into it. And there's a bit of a guess involved at the beginning, but if I knew now what I knew, if I knew then what I knew now, I might have thought twice about it. But I'm glad we've gone through with the program and we've got to end game. Um,
Well, and I think one of the things that I think is kind of neat about what you've done is that you start off early with the idea it was all flexible, silicone that can withstand high heat. And you've stayed in that category. So, I've seen some people have an idea, work on that for a while, and then they get, oh, I think I like this idea better. And it's a completely different, you're out kind of outside your realm and you have to start over. I love the fact that all your products deal with this flexible silicone, and you've come up with ideas that take that material and
mm.
expanded its use, and that's what you've become known for is, these brightly colored, autoclavable, flexible, kind of rubber-like polymer materials. And yet you've got multiple products out of that. I mean, once again, I think that's genius. That's what you become known for. And I think when you come out with something new, it's easier to market something that it's in the same family than, oh, we have this new, brand new thing, because people recognize your product.
Yeah, the marketing I always think is was my probably my weak point, and I was lucky that Hazel has been just brilliant at that. She's great with people. She goes to all the conferences, um, and we've managed with this activity to engage good dealers across
Mm-hmm.
many continents from Japan, Australia, America, Canada, New Zealand, Europe. Um, and we've always worked with the smaller companies, mostly worked with the smaller companies who can focus on our product more than a large company that it sort of tends to get a bit lost in their big catalog of products.
Right. Right.
Um, I always think of our products, they're sort of bag openers. There's something you can walk into the practice and they can say, have you seen this? And the dentist
Yeah.
goes, show me.
Uh-huh.
Uh, it has that effect, but um, it's a lot of work doing the marketing. And I've learned skills like how to label products and pack products. And with COVID, we developed an online website um, so we could sell online
Mm-hmm.
to countries where we didn't have dealers. And actually, in the US, we've engaged AGA worldwide, sell our products, and they call the Vision Butlers called the Spandex Advanced.
Ah, okay.
So it's very difficult regulatory wise. You've got to fit in with the import regulations
Right.
and FDA compliance, etc. So you need to have an agent who can do that for you on site. Um, so they've been very good, and all our products are available through Hager worldwide.
You
Um,
know, that's something else you mentioned that I think is important. Many times over the years, I've had doctors reach out to me who have invented something, and they'll call me or email me and they'll be very enthusiastic. They'll say, we I've just signed an agreement with, and I'm not going to mention names, but a huge dealer,
mm,
and I've been working really hard, and this is going to do it. This is going to give us the sales we need. And unfortunately, like you said, when your catalog is that thick, the
it gets
sales
lost.
reps, they don't have just your product to market. They go into an office and they have thousands of products, and it's very easy for your little whatever to get lost in that. But
Mm.
you had a great point of dealing with smaller companies that can give your product some attention in front of doctors. That makes a tremendous difference than just being listed on page 400 of somebody's catalog that you hope somebody flips through or comes across.
Yeah, it's not intuitive, is it? You'd think big
No,
company would be best, but sometimes the middle-sized company does a better job for you.
yeah,
Um, and it's like when you go around those trade shows, sometimes it's more interesting to go to the little ones than it is the big
yep.
ones. That's where you see the innovation for that reason.
That's where I
Um,
prowl. When I go to trade shows, I will often walk through the areas where the small booths are because, like you said, that's where you find people that are thinking outside the box.
yeah, yeah. It's it's been interesting learning all of this process. As a dentist, it's tend to come at the end of my working day, but now I have more time because I'm only working two
Right.
days a week. That's been great, and that's helped us develop this over the last few years to where we are now. So it's all very exciting, and I'm hugely excited about the change that we can bring to the environment on this. I mean, one of these is equivalent to 1,000 disposable units. That's a
Yes,
lot of waste. Um, and if you look worldwide as to how many disposables are used, that's a significant impact that we could bring to the profession to help
absolutely.
environment. So
Yeah.
as well as reducing costs and increasing comfort, it's quite exciting. Uh,
Yeah. And it's and your things are simple ideas too. It's not like you need to spend a lot of money to buy it, invest a lot of time to train on it. It's something, I mean, the burr and the endo system, it's just simply take the old thing that you're using, put it aside and use this. Not like, okay, well, it's going to take the staff weeks to get used to this or whatever. It's really just it's a plug and play. One of the other things I wanted to bring up about the CEREC block holder
mhm.
is that the inventory, and I know we kind of talk inventory, but when you can look at something and say, we've only got 3 of those left, as opposed to having to open a box and say, oh, there's 3 here. Oh, but somebody else opened this box and there's 1 here. When you keep them all in the same place and you can see them all at the same time, it just
Yeah,
gives you immediately know, and then you don't get that thing of we don't have any A2 blocks today, or we
yeah,
don't have the block in that material that you want. We don't have lithium disilicate today. It just makes things so much easier.
when you've got your patient sitting in the chair and you're booking them in for 4 crowns tomorrow on their 4 front teeth, and you look on the wall because these wall mounts, you can stick them on the wall. There's 2 little holes at the top,
Okay.
and I have 6 of these that keep my stock. I can look at that and I can say, oh, I've only got 3 A2s in low translucency.
Yes.
I know I can't book it tomorrow. I have to order the stock first. Um, but the other one with it is when patients walk in through the door, they always say, "What are they?" And you can
Yeah.
tell them
Oh,
the
I can
story
see that.
of what the purple blocks are. And I actually asked them to go up and pick their own color and things like you can make a story out of it. And the story
Yeah.
sells helps you give them confidence that they're going to get a job that they'll be happy with.
Well,
Um,
and I would be willing to bet you they leave the office and at some point in time, they're going to tell at least one other person about that. And then that's
I always,
going to get your name in front of more people too.
I actually always ask the patient when they're in the chair, say, do you have a telephone with you?" And when I'm designing the CEREC crown, I say,
Yeah.
"Turn your video on and just watch this." And I can talk them through their models. I can say,
Right.
this is your occlusion, these teeth are missing, and I can show them the inside view that they've never seen before, and they can
Right.
see me design the crown, and then they'll take a picture of the blocks on the wall and the machine milling it, and what happens to that picture? It goes around all relatives. I put it
Yeah.
on the group family chat. Uh,
Yep. Ends up on
and
Instagram.
that's a fantastic communication.
Yeah.
Mm. And
Absolutely.
not so many of them will show a picture of their teeth.
Yeah.
That's more a dentist
Right.
thing,
Yeah.
but it's come. Uh, it,
Yeah. No,
yeah,
that works well. I love that. I would have never thought of having people video the design. That's actually a really good idea. I wish I'd have thought of that.
so they're all fascinating. Even
Yes.
25 years later, I still get people, you know, the design that we're doing, and that helps them explain what's going on. I do that at first visit when I'll scan the patient rather than give them a mirror and say, "We're going to do this, this, and this." I'll
Right.
scan the patient, sit them up. I'll talk them through their treatment plan on the screen.
Yes.
It's great.
I've
It's
had
a great trick.
I had a
But,
patient in not too long ago that we were doing a crown, and she's been with me for a very long time, and she's had several crowns done over the years, and she said, she just amazes me how much it's changed. You used to have to use goop and have bite into that stuff, and then you went to, like you had a machine that took pictures, and now it just shows up on the screen. And she was talking about how you don't have to adjust them anymore. You used to have to kind of grind to make my bite get right. And once again, I mean that's incredible marketing, um, because they tell people about things like
mm,
that, and it's kind of I felt good because I felt like, well, maybe she has been paying attention, to what we're doing. But yeah, she remembered, the different ways that we did it, and they patients understand when you're doing things digitally, you're doing it because it's better for them, and you're getting better results. No doubt about that.
you can. We actually wear these when we're doing the digital scans as well. Keeps the lips out of the way. Touch.
Everybody puts one on. I love
Well,
it.
I don't wear them. I don't wear them. The patient wears them. But, yeah,
No, and
yeah.
that's easier too.
We,
It gets the lips and the cheeks out of the way better when you're doing the scan. So I can see that.
we had an interesting one the other day. My grandson came in. He's got enamel hyperplasia, and we're trying to get his oral hygiene good. We gave him one of these, and he now wears this when he's brushing his teeth. And mum can use a disclosing solution, electric toothbrush, and it becomes a game, and
Yeah.
parent and child can see. And the very next day, I had a 90-year-old in who'd had a stroke,
Oh
and
gosh.
his carer can't clean his teeth,
Right.
but he can wear one of these, and the carer can clean his teeth.
Yeah. No, that's
We haven't.
great.
It's an interesting idea. We haven't
Yeah.
really thought all that much, but it's a potential use for the Vision Butler or
No,
spandex.
absolutely.
Yeah. So
So Paul, as we kind of start to wrap up, let's know again, how can people find your products online? How can they find you?
We have, you can look at all the range of products online on our online website, which is sterilu.com. That's STIERILIU.
Okay.
Um, that means sterilize in Irish, by the way.
Ah, okay. Good to know.
That's where the name comes from. But in America, we've got Hager Worldwide are
Okay.
acting as our agents or distributors in America. So we've got lots of information. They've got lots of information, but uh, yeah, well, you can always email us. I'm sure you've got my email details there. If anyone wants to
Sure, we
ask any
will.
further questions, we can
Yeah.
post that for us, perhaps. And
Well, and I will tell you too, if you're interested in looking at the retractor, any of his products too, if you just Google Vision Butler, it'll show up, and
it will.
that works as
Uh,
well. So
Hazel's coming to Chicago
terrific.
to the Midwest meeting. So anyone who wants to come and have a chat with Hazel will be able to see her there on the Hager stand. Um, and we've got new distributors in Canada called Curian. So yeah, it's available all across America, north and south. So
Great. Well,
excellent.
Paul, thank you very much for spending the time with me. It's always good to talk to you, but this has been kind of a fascinating discussion on the journey that you've had in developing these things and getting a chance to show people what they do and how they work. So thank you very much for joining me. I'm really grateful. Everybody, thank you for watching, because we're nothing without an audience. So you make us successful, and I am grateful for that. I'm also grateful to Medidenta Digital for sponsoring this, and give them a shout out as well. Until next time, I'm John Fluke, the Technology Evangelist. This is the Technology Evangelist Podcast. Thank you so much for watching.